This is a short introduction for patients and members of the public to the quality and outcomes in oral and maxillofacial surgery project. A longer video is also available on our website. Oral and maxillofacial surgery is a surgical specialty interested in the diagnosis and treatment of disease affecting the mouth, jaws, face, and neck. It is a relatively young surgical specialty. Its areas of interest overlap with other specialties like plastic surgery and ear, nose, and throat. Oral and maxillofacial surgery includes several subspecialties like oncology, reconstruction, wisdom tooth, trauma, and many others. In the current healthcare landscape, clinicians need to show that the care they provide is of the highest quality, that it has a positive effect on the patient's health and well-being, and that its provision is sustainable within existing economic constraints. Currently, there is no national data collection system for monitoring performance in the oral and maxillofacial surgery specialty. That's why the British Association of Oral and Maxillofacial Surgeons initiated the Quality and Outcomes in Oral and Maxillofacial Surgery project, or QOMS, to be a national quality improvement in clinical effectiveness program for oral and maxillofacial surgery. We are interested in improving patients' outcomes and services by looking at real-world data, that is, information created and collected during care. Databases where clinical data is stored are called clinical registries and can be used for different purposes. They can be used for quality improvement. Their aim is then to review clinical performance against standards and taking remedial actions when those standards are not met. This is generally achieved by performing clinical audits and service evaluations. Registries can also be used for clinical effectiveness to bridge gaps in knowledge. For example, they can be used to identify treatments for rare disease and to assess the safety of new procedures. Each process hinges on collecting patient outcomes. Basically, we need to collect data about patients. Overall, QOMS aims to draw an accurate picture of oral and maxillofacial care in the UK, for surgeons to measure and improve their performance, for patients to be able to make informed choices about their care, and for commissioners to support provision of oral and maxillofacial surgical care. Given that we are collecting information about you and other patients, security is paramount. Data is stored securely and encrypted in a database. Data access is controlled and limited only to the people who need to. Before being analyzed, data is transformed and anonymized so identifiers are no longer visible. Data is not shared with unauthorized third parties or for any commercial purposes. Data is kept for a limited amount of time only. What do we mean by data? Patient data can be divided into identifiable information like name, NHS number, gender, date of birth. They are generally used to communicate with clinicians and to track patients across hospital systems. Clinical data includes information about health, diagnosis, surgery, and recovery. They are used to assess outcomes and performance. Both types of data can be used to describe, adjust, and compare the results. Here, we are only collecting the information essential for our purpose. This process has been surgeon-led, based on expert opinion and literature reviews, but we hope that patients will help us shape QOMS in the future. Here is the list of the main patient identifiable information we collect. NHS number to link QOMS record with hospital records. Gender and date of birth are used to double-check NHS number validity and for risk adjustment. Risk adjustment refers to a set of statistical techniques used to adjust results according to some data characteristics to make the results more comparable and easier to interpret. Postcodes are also used for risk adjustment, to make comparisons between hospitals and to assess postcode lottery. To achieve this purpose, QOMS will run a series of registries covering the following areas of oral and maxillofacial practice: oral and dental alveolar surgery, oncology or cancer, orthodontic or jaw surgery, reconstruction, trauma, skin cancer, and salivary gland cancer. If you would like to find out more about QOMS, please visit our website or send us your question to quoms@bams.org.uk. For updates, follow us on Twitter and Facebook. Thank you for taking the time to watch this video.